afternoon. It's a pleasure to be with you here today. I'm Dr. Henk Schallig from the Parasitology Unit in the Netherlands at the Academic Medical Center. And we've been really delighted to have you here today speaking at our Diagnostics Day at ISNTD D3. So I was wondering if you could just briefly tell us about your research today you presented, and also kind of in general what you've been working on recently.
Yeah, thank you very much. First of all, I must say that I've enjoyed the meeting very much. It was really a good, exciting meeting with a lot of interactions. And it's also a very good platform to talk about the work that we have been doing. Our work is mainly focused on developing new diagnostic tools for parasitic diseases, mainly in the field of malaria and leishmaniasis. And one of the things that we really would try to do is to bring molecular diagnostics, which are acknowledged for being the most sensitive tools to detect a parasitic infection, to bring that closer to the patient in resource-poor settings. Now, of course, that is a bit of a dream, because there's a lot of technical problems that you have to overcome to finally achieve this. But I think step by step, and incorporating technological developments also from other groups and institutes, that in the end of the day we will be able to achieve this to a certain level. I don't think that it will be possible to do this, let's say, near bedside, under the tree, somewhere deep in Africa, but in a setting where there's some resources available. I think that in the end of the day, molecular biology should also be implemented for diagnostics over there.
That's absolutely fantastic, and we've heard today so many descriptions of innovations and breakthrough, and a really exciting time for diagnostics, but also again a lot of challenges still in the way, as you described. And looking at your particular approach, what might be some of the biggest hurdles yet that you've got to overcome?
Well, what we have developed is an assay that doesn't require DNA extraction. It also has a very simple readout system, so you are not using very specific equipment, or it's in a closed system, so that you can avoid contamination of the environment, so that reduces the number of false positive reactions. But our test is a PCR-based test. That is, of course, something that, if you can have criticism about this test, people would say, yeah, but you still need a PCR machine. Well, I always try to rebut that a bit by saying, yeah, PCR machines, they are becoming cheaper, smaller, they can also work on solar power. So I think, and that may be my dream, that in the end of the day also these types of technologies will be really available for more field conditions. Ideally, our technology should be combined with other isothermal platforms, like we have seen here, and we have also tested some of them ourselves. But they have shortcomings on the other end, that often you still need DNA extraction, or you cannot do species differentiation. So really, let's say the perfect test is not there yet.
Not there yet, yes, and we did see this morning examples of PCR type machine running off an iPhone, and so forth. So definitely the pieces of the puzzle are coming together.
Yeah. I mean, technological development goes very quickly. I mean, if you think that PCR as a technology itself was only developed 30 years ago, something like that. And then we had big machines, it was all difficult, and now we can do it in very small apparatus and simple readout things. Yeah, these are exciting times, and we also need these simple tools, because we are also in a time that we are talking about elimination or eradication of certain parasitic diseases, and for that, most likely you will need those sensitive tools. That's really something to look forward to.
So we did conclude today's day looking at elimination and eradication on the way to 2020. So how will diagnostics facilitate the route towards elimination?
Yeah, I think they are essential, because you still need to find those last pockets of parasites. Maybe you don't need to find the last parasite in the last patient, because at a certain level you will break transmission. But especially to identify hotspots or to monitor the efficacy of your intervention, these tools are needed. And also for monitoring, because what we may see is that people will see, okay, these are successful approaches, like the MDA programs, and then they will sit back, relax, and say, okay, we have achieved this. But no, you still have to keep on monitoring, and that you have to do with good tools. So in that respect, I think also molecular biology has its role, has its place, and certainly diagnostics in general have its place.
And have you in this approach focused on specific areas or countries?
No, not yet. No,
not yet.
No, not yet.
Is it something you're looking to
we are thinking about a country like Gambia. They are really approaching fast, at least in certain areas, to elimination. And we really would like to implement our technology in control programs over there.
Possibly looking for partnerships?
Always looking for partnerships. Yeah, always
okay.
looking for partnerships.
All right. Well, we also have your presentation available to view alongside this interview. So, if anybody wants to find out a little bit more and perhaps get in touch, then we will encourage them to do so. And in the meantime, I'd like to thank you very much for your time today. It's been really a privilege to have you. You often attend D3. Today you're presenting again, so thank you very much.